Coming on to a very important part, which is mercury toxicity. Now, mercury vapors should not be inhaled nor should mercury come in contact with skin, because as I told earlier, it can produce type 4 hypersensitivity, which is the delayed type. Cumulative effect is observed. Now, cumulative effect is observed. Now, what are the precautions that one should take? Precautions. The clinics should be well ventilated. Pre-proportioned capsules should be used so that mercury and alloy ratio can be low. Capsule should be used. They should have tight fitted caps over the capsule. Protective barriers like rubber dam for isolation should be used. When the dentist is removing the old fillings, while removing old fillings, a water spray, a mouth mask, and high volume suction is to be used. Then the use of ultrasonic condenser is not recommended. Ultrasonic condenser, amalgam condenser is not recommended. All of the excess amalgam should be sealed in containers. Proper disposal should be followed. Extracted tooth containing silver restoration should not be discarded directly. Should be disposed in an incinerator. Spilled mercury should be cleaned as quickly as possible. There should be amalgam separators in clinics. Some of the advantages and disadvantages of dental amalgam. First of all, it is reasonably easy to insert. Second, not overly technique sensitive. It has the property of self-sealing. It maintains anatomic form well. Fifth, it can be easily carved, and it has adequate resistance to fractures. When inserted well, and it is quite more economic. Now coming on to the disadvantages. The first one is requires removal of sound tooth structure. Second being, it fractures quite quickly if not placed well. Fractures quickly when not placed well. Third, it shows micro leakage. The biggest problem is not aesthetic. Fifth, it is brittle. Sixth, it also shows galvanic action, that is when you place amalgam restoration on a non-amalgam restoration, then saliva being the electrolyte, the electrolytic cell is formed, due to which a shock is produced. Then it also shows marginal breakdown. It has biological effects. It shows temporary sensitivity to heat and cold. 10th, does not bond to tooth structure. So these are the advantages and disadvantages of dental amalgam.